my question to Congressman Jody Arrington, who joins me now. Now, we've got a lot of other things to discuss, but Congressman, here's the audience, in this case, Dave in Michigan and others who are asking the questions, what can be done about Obamacare? Democrats fought for subsidies they never got, they shouldn't get, but now the speed and efficacy in doing something about it.
Well, the caller's right. Obamacare is a rotten egg. He said it. It's true. It's rotten because the taxes, the mandates, the regulations are structurally flawed, and they push premiums and deductibles up. We've now had a doubling and even tripling of cost in Obamacare, and taxpayers are fronting it. So it's been a failed experiment, okay? Let's just all call it what it is. But Republicans, it's incumbent on Republicans, to the caller's point, to have reforms. Look, if ACA is not going away, you can go after the cost share recovery, the medical loss ratio. These are the guts of the Obamacare program that would, in the case of the cost share recovery, which is just another way, if we could dig in, it's another way that the insurance companies are gaming the system to get more money by increasing premiums. We had it in our House big, beautiful bill. The Democrats fought it in the Senate, even though President Obama was for this reform. It would have saved taxpayers $30 billion. It would have lowered premiums, according to the Congressional Budget Office, by 12%. So that's just within the ACA in terms of reforms, but there's association health plans, there's site-neutral payments. David, we're paying hospitals more than we pay physician groups for the same outpatient procedures. If we just equalize payments, and by the way, this is another Obama and Biden proposal that Trump also included in his budget in his first term, it would save taxpayers $150 billion, and we would stop the consolidation that is reducing patients' choice and making us price takers and having the cost of care run away. So plenty of things to do that will actually bring down the cost of health care, not artificially subsidize the cost and actually prop up a program that's driving cost up. That's what the Obamacare enhanced premiums would have done. That's why Democrats couldn't even make it a permanent fixture when they had total control, a few years ago. They couldn't even get the votes to make it then, but that's what their demands somehow were in this shutdown.